This neurological situation didn't have some similarities with the previous talking, but it's some kind of mixture of everything, like everyday's life in the hospitals are. So the name of this presentation is Status Post-Meningitis and Encephalitis 20 years after the infections. So, infections of central nervous systems are very serious disorders and unfortunately happen nowadays, and if not treated can lead to death. Nowadays we still notice presence of them. In our study, it's a quite a little bit study, we traced neurological and psychiatric consequences, if they are existing, and problems of 30 patients, age 35 plus minus 5 years old, who survived meningitis or encephalitis in the early adolescence between 12 and 14 years old. They had been admitted at daycare hospital because of cephalea. That's the old-fashioned term for headache, panic attacks, to control EEG, emotional instability, impulsivity, panic attacks, compulsive behavior problems, anxiousness. So, if necessary, CT of the brain is what 50% of the patients have already been CT of the brain because of previous problems. Aim of this little study was we tried to find out are existing any significant and link between. Okay, grazie. Is it existing a link? We're trying to find out are existing any link and significance among duration of infections of central nervous systems, duration, type viral or bacterial, and if have happened seizures before, and psychiatric consequences after 20 years. Also, if notice any significance and link, what are the what are actually the significance of psychiatric consequences after? Method was follow-up study. So we traced 30 patients at daycare center. They were traced. In anamnesis, 80% of them had survived meningitis by pneumococ or enterococ, and 20% of them have survived encephalitis. Okay. EEG was controlling, of course, all the time, and CT brain, if necessary, in 0.5% of this patient. CT showed different abnormalities from edema cerebri to frontal problems, frontal reduction of gray cells, cerebellar, it means reduction of the base, like something like rhomboencephalitis before, and reduction of gray cells. For measured depression, we use Montgomery-Ashburg scale, Beck scale, and we also used Zancke self-rating scale. This is one typical CT brain after viral meningitis. You can see it is 20 years after. A little edema. You can also notice some, as I mentioned, some abnormalities. This is a typical CT brain after bacterial infections, meningitis and pneumococ. You can notice that the main reduction of gray cells are bitemporal and in the down lobe where is the cerebellar reduction. And one specificity, all these 30 patients nowadays are doctors. So they saved all their documents from early adolescence when they was admitted in infectious clinic and after. Maybe because of that they have so much documents. Because during 40 years, for example, some people lost medical documents, but they have everything. This is the typical EEG abnormalities that you can notice in the temporal lobe, typical problems that have had to be solved with medicaments. As a result, we can say that 20 years after severe infections of central nervous systems, we notice that just 20% have visible EEG abnormalities, so frontal and bitemporal mostly. No seizures, but 10% of them got anti-epileptic therapy. 50% of patients diagnosed as panic attacks and felt much better using clonazepam 4 milligrams per day. 20% diagnosed a depression mild and recovered on escitalopram, 10 milligrams per day in the morning dose, and 10% diagnosed personality disorders F60,3 according to ICD-10. Okay. I was warning that I'm so loud. I'm so sorry. So, as a little conclusion, evaluated studies show that the duration of infections on central nervous systems and seizures, if had been happened in early adolescence before, after 20 years, consequented in irritability and instability of EEG, as well as behavior problems, so needed medicaments treatment. Lamictal, 50 milligrams per day, if EEG abnormalities are not so severe, or carbamazepine, 200 milligrams per day, if the temporal, bitemporal abnormalities are very, very severe. And as a very important conclusion, it's a very little study, it's a very little number of persons, but bacterial infections, pneumococcus and enterococcus are more linked in depression after 20 years. After escitalopram, the significant improvement we notice, so in back scale we have 23 points before, after 12. Montgomery-Ashburg on 10 items, we have 40 points before, 10 points after. And Sang's self-rating scale, we have 0,5 after 0,2. And as a difference, viral infections, if they have been survived, obviously survived, more linked in anxiety, panic attacks, and personality disorders. So if you remember, and I'm sure that you remember, the viral infections are more linked to the limbic system and to the white zone in the brain. So it is it is predictable that it will be somehow connected with personality disorders. And also they felt better using clonazepam, using carbamazepine and Lamictal. Thank you for attention.